As African countries work to strengthen their response to infectious diseases, a regional workshop on vaccine effectiveness has brought together experts to build the continent's capacity for generating real-world vaccine data. The initiative comes at a critical time when health systems are under pressure from recurring outbreaks and rising public health demands. Well, joining us to discuss the significance of this workshop and the broader challenges in global health is Professor Francisca Mutapi, who's a leading specialist in infection and immunity and is also the co-director of the Global Health Academy at the University of Edinburgh. Prof, thanks very much indeed for joining us and welcome to the program.
Good morning, and thank you for having me.
Professor, let's start with this workshop in Brazzaville. What were its core objectives and why is building vaccine effectiveness research capacity such an urgent priority for Africa right now?
Thank you for that question. So, we know that Africa has a disproportionate burden of infectious diseases. And we also know that one of the most effective and cost effective ways of controlling infectious diseases is through vaccination. And we all know this, for example, from our childhood vaccines. Now, one of the challenges is that vaccines are not normally developed and tested on the African continent, so that by the time they arrive on the African continent for use, they've already been evaluated somewhere else. We know they are safe there and we know they work very well. But African populations are different. Our diet is different. Our genetics is different. So even if we know that the vaccine is safe and it works in other populations, we need to be sure that it is doing the same job or even better on the African continent. And this is where vaccine efficacy studies come in. We monitor how those vaccines are performing in the African population. And this gives us good data for the relevant population, and we can also use this to gain the public confidence in terms of acceptance of vaccines. So it's very important that our African scientists have the capacity to evaluate these vaccines and use local data to then inform our ministries of health on ways forward.
So the workshop brought together public health experts from more than a dozen countries. I'm wondering what skills or competencies were prioritized and how these would translate into perhaps stronger outbreak responses on the ground.
Great. So, what you do when you have a vaccine and you're deploying it, in addition to monitoring how many people are vaccinated, it is very important to have local data on how the vaccine is performing in your local information and your local population. So it's not just an easy way of collecting people when they get into hospital to check how vaccines are working. You have to follow specific procedures. So it's a combination of doing epidemiological studies, immunological studies, and clinical studies. How you do this requires competencies and capacities. Following on from that, how you then record that information and make use of that data within your National Health Information Services or your Ministry of Health. So this is what we have been training the participants from the several African countries on how to do this. In addition to that, we don't work in a vacuum. So various organizations and various ministries of health throughout the African continent work together. The expertise and the experts work together to say, hey, I'm seeing this in my country. Are you seeing the same thing? Or I'm having a challenge uploading this sort of data. Are you seeing the same thing? So that kind of information sharing is also a very critical network that has been established as part of these training workshops.
We've seen in the past vaccine hesitancy. Some countries, whether it's culture, religion, you name it, and in COVID we even saw it. I wonder if creating homegrown vaccines might help in terms of generating confidence in vaccine programs?
Oh, you ask a very, very pertinent question there. Homegrown vaccines is the ultimate goal, not only for addressing hesitancy, but also for health security within the countries and also for prioritizing diseases within your own country. You see, for example, that a lot of the vaccines we have in Africa also target other diseases that are of priority in other countries, but not necessarily cover all the priorities within local countries in Africa. So having the capacity to develop, deploy, and evaluate locally produced vaccines is absolutely critical for the entire health system and health ecosystem on the African continent.
The WHO's Afro Move network was established during the COVID-19 pandemic. And from your vantage point, how has the network evolved, and what does it now enable that wasn't possible perhaps a few years ago?
Again, another brilliant question. So, up until the COVID-19 pandemic, we had capacities on the African continent to deploy a vaccine and check how many people have been vaccinated. But we didn't actually follow through in a systematic way how that vaccine is working in the populations. So, is it actually protecting in the way we want it to protect? So, this was something that was established through the COVID-19 pandemic because we wanted to know whether this new vaccine is inducing the protection that was needed either to stop infection, to reduce disease, or to stop transmission. And at that stage, it was quite apparent that we'd never done this for any other vaccine. And yet, we are producing and also introducing new vaccines almost every year. So, the AfroMove has now morphed into an organization that allows African ministries of health, African researchers to follow very defined protocols in a systematic way to see how new vaccines are behaving on the African continent. So, for example, we have a new malaria vaccine. What our colleagues who have been trained in the AfroMove are now doing is conducting vaccine efficacy studies in their own countries to see how well the malaria vaccine is doing. We have a series of about 10 more vaccines that are going to be introduced in Africa over the next 5 to 10 years. We now have the capacity on the continent to check how these vaccines are working on the continent. It's very important because you can see that some vaccines are working and protecting about 40 to 50% of the people when they're supposed to be protecting even more than that. So these studies will now allow us to check, why is this happening? Is it something that's dietary that we can improve? When we have that information, our ministries of health can strengthen our health systems and help us to ensure that we are putting this vaccine to the best use on the continent.
Do you have a timeline and an ideal outcome in terms of when we will be, as a continent, vaccine self-reliant?
Oh, I wish I had that magic ball. My other hat, when I'm not looking at vaccines, is looking at really strengthening the African health system with local manufacture of not just vaccines, but of drugs. This is a long-term ambition. We hope that we will be seeing the first generation of African vaccines, within the next year. I would love to say for Christmas, we are deploying a new homemade vaccine in Africa, but not yet. We're working through it. Just watch the space. We'll get there.
And we wish you the best of luck with that, certainly. Thank you so much indeed, Prof, for joining us on the program.
Thank you for your time and have a good day.
Thank you. That's Professor Francisca Mutapi, who's a professor in global health, infection, and immunity, and also co-director of the Global Health Academy at the University of Edinburgh, speaking to us about this workshop to deal with the ongoing struggle that Africa has been grappling with, and that, of course, is dealing with recurring outbreaks and mounting public health pressures. And this has brought pressure to bear in terms of making reliable, locally generated vaccines more essential than ever. And there is hope that we are moving in the right direction with gatherings such as this one that took place in Congo-Brazzaville just this past week. All right.